Good afternoon. I'm Don Calloway, CEO of Pine Street Strategies and the National Voter Protection Action Fund, and I promise you that I have on pants under this suit. Over the course of the last 2.5 days, greetings and welcome to the 17th Annual National Minority Quality Fund Summit on Health Disparities and the CBC Health Braintrust. Over the last 2.5 days, we were able to hear about everything from the National Urban League and the Divine Nine on minority representation in clinical trials to the 2020 political landscape around health issues. We were able to honor medical device company Medtronic for their work to diversify and promote talent in their company, and the Pro Football Hall of Fame in Canton, Ohio, for all the great work that they do in communities across the country. Finally, we're here today to honor our 5th class of National Minority 40 Under 40 recipients. These doctors, nurses, dentists, health policymakers, patients, advocates, and researchers are changing healthcare in our country for the better. We'd like to thank Amazon and one of the Brandons, my brother Brandon Webb, for being the title sponsor of this year's 40 Under 40 winners. And finally, we'd like to honor 2 guests who are working hard every day to protect us and lead us during these interesting and unprecedented trying times. The Honorable John Lewis Lifetime Achievement Award winner this year is Chicago Mayor Lori Lightfoot, and America's doctor, Dr. Anthony S. Fauci, receives our Bernard J. Tyson Lifetime Achievement Award. Now I'd like to pass things to NMQF's own, my brother, Brandon Garrett.
Hey everyone, thanks for joining us for the past 2.5 days. Thanks for being with us today. Thanks to Brother Calloway for again hosting us, this time, no, not virtual, but he's still with us. He can't joke on Mr. Butterfield personally, but I'm sure he will later on this week. I just wanted to make sure that I said thank you all for joining, but then also want to thank the people that made this thing happen. I want to start off with our very own Keiko Purnell. Keiko just joined NMQF at the end of last year, and she was sort of assigned to help put this whole event on, and without her, this would not have happened. I mean, everything, she spoke to every moderator, every panelist, every presenter, every awardee, and without her, I tell you that we would not have had a summit this year. So thanks to Keiko. In addition to Keiko, I'd like to thank everyone on the NMQF and CBC Health Braintrust teams. I'm going to actually say their names because in the last 7 years that I've been here, I don't think we've ever said the names of the folks that actually put this on. So always we're going to start with the founder, Dr. Gary Puckrein, who founded this organization in 1998 and started this summit in 2003. Chairwoman, Congresswoman Robin Kelly, who was my boss and in the personal office, and then still my boss here at NMQF. And I really appreciate all she's done, especially in the advocating for better healthcare. Then our NMQF in teams, Dr. Lou Zhao, Gretchen Wardman, Taylor Stair, Dr. Laura Lee Hall, Dr. Latasha Lee, Mary Stober Murphy, Margot Payne, Nicole Varner, and Matt McMurray. So just want to let you guys know that those are the folks that actually put everything on and made it happen. Special thanks to Courtney Lang and Joy Perry for making sure that we got everybody we needed. And finally, we'd like to thank Vote Lab, who's helped us with all the communications, and then another group of people, NPS Strategies, Lushane and Nina, and Specs Management, who helped us put this conference on. They have actually been working with NMQF longer than I have, since the early 2000s, putting on the summit from 05 to last year in person at the Ritz. We look forward to being with you guys next year at the Watergate Hotel. But we're doing what we can here and making sure we continue to encourage and enlighten and educate. And so with that, I turn it back over to Brother Calloway.
Thank you so much, Brother Garrett. And thank you to Dr. Puckrein, also my great frat brother, Keiko Purnell, and all of you all at NMQF who continue to recognize our fantastic achievers in healthcare across the board, and who continue to do the hard work in Congress and throughout our country's policy circles every day to make sure that regardless of the zip code you're born into, that will not determine your healthcare outcomes. Now, as we always do about this time, we are excited to present you all the 40 Under 40 achievers for the National Minority Quality Forum for 2020. And here they are. the 2020 National Minority Quality Forum 40 Under 40 Leaders in Health. Norman Ajiboye, medical doctor. He's the assistant professor of neuroendovascular surgery at the TCU UNT School of Medicine and Texas Stroke Institute. Ndidiamaka Amuda Onugaka. She's a PhD and MPH and associate professor at the Tufts University School of Medicine. Ruth Arumala, DO, MPH, NMCP. My Mansfield OBGYN affiliated with Hughley Medical Associates. Binta Beard, MS, Director of Federal Government Affairs at AbbVie. Ashira Blazer, MD, MS, Assistant Professor of Medicine and Division of Rheumatology at the NYU School of Medicine. Representative Yadira Caravello, Medical Doctor, State Representative in the Colorado General Assembly. Meghana Chalasani, MHA. She's a Senior Research Analyst at the United States Food and Drug Administration. Dr. Nicole Cooper, Doctor of PH and MPH, Vice President of Social Responsibility at the United Healthcare. Damian L. Cuffey, DDS, MPH, Assistant Clinical Professor at Louisiana State University, Department of Oral Diagnostic Sciences. Hari Deshmukh, MD, F.A.H.A, F.A.S.A.M, CEO and Medical Director of Balanced Wellbeing. Dr. Kimmy Dole, MD, MSCR, Assistant Professor at the University of Washington. Joshua Ellis, MD, Medical Education Fellow at the Beth Israel Deaconess Medical Center. Travelle F.F. Ellis, MD, PhD, Associate Director of Minority Initiatives at Zimmer Biomed. Dr. Amaka Inanya, MD, MPH, FASN. She's the Assistant Professor at the University of Pennsylvania. Audrey Escobedo-Escotto, MD, MPH. She's the Site Director at the Emerson Clinical Research Institute. Dr. Jose Figueroa, MD, MPH, Assistant Professor of Health Policy and Management at the Harvard T.H. Chan School of Public Health. Dr. Arika Hoffman, MD, Assistant Professor of Surgery at the University of Nebraska Medical Center. Dr. James Wang, MD, F.A.H.A. He's the Family Medicine Physician at Unity Healthcare. Monique Jindal, MD, Internal Medicine Pediatrics Physician at Johns Hopkins University. Christen Johnson, MD, MPH, Resident Family Physician at The Ohio State University, Wexner Medical Center. Rashard Johnson, MHA, he's the President of Advocate Trinity and Advocate South Suburban Hospitals. Joshua J. Joseph, MD, F.A.H.A, Assistant Professor of Medicine at The Ohio State University, Wexner Medical Center. Paul Valerie Joseph, PhD, RN, MS, FNP, BC, CTNB, the Lasker Clinical Research Scholar and Investigator. Abrar Karen, MD, MPH, DTM&H, Resident Physician at Brigham and Women's Hospital, Harvard Medical School. Chad Lewis, MPH, he's a medical student at the Dartmouth Geisel School of Medicine. Dr. Marlene Martin, MD, Director of Addiction Care Team, Assistant Clinical Professor at the University of California, San Francisco. Virgil Miller, MPH, Senior Policy Advisor at Aiken Gump Strasshauer and Feld. Janelle Nichols, MPH, Director of Programs at the Washington Tennis and Education Foundation. LaShira Nolan, BS, Student Body President at Harvard Medical School. Otis Sean Owens, MPH, PhD, Assistant Professor at the University of South Carolina. Ramana Ramaswaran, JD, NR-EMT. He's an associate at the Catton, Minuchin, Roseman, and Uckland Ambulance Corps. Chat Razdan, MBA, co-founder and CEO of Care and Wear. Orriel L. Richardson, JD, MPH, professional staff and health counsel for the majority staff on the Committee of Ways and Means at the United States House of Representatives. Dr. Carolyn Robinson, MD, F.A.H.A, board-certified dermatologist and CEO of Tone Dermatology. Brandon Risher, MA, LPA, HSP, PA. He's a psychologist at Risher Counseling and Wellness Center. Dr. Robert Rock, MD, family physician at the Montefiore Department of Family and Social Medicine. Dr. Carrie Sutton, PhD, Director of Health Equity Research and Workforce at the Association of American Medical Colleges. Farah Tejbar, MD, Section Head of Non-Surgical Orthopedics and Sports Health at the Cleveland Clinic of Florida. Garth N. Walker, MD, MPH. He's the attending physician at the Jesse Brown Veteran Affairs Emergency Medicine Center. Karen Wilson, PharmD, Director of Inclusion Strategy and Partnerships at Genentech. And there they are, our 2020 class of 40 under 40 honorees at NMQF. Welcome to the National Minority Quality Forum family, and we congratulate you for all of your achievements and thank you for all of your hard work in keeping our communities healthcare delivered equitably and safely.
First, I just want to, acknowledge the 40 under 40. I'm an old dog now. When I was growing up, we weren't able to get into medical schools and graduate schools. I was part of really the first generation of students who were able to attend advanced degrees. In fact, even at the BA level, it was almost impossible for an African American and many minorities to get into these schools. It looks so much different now, over the last almost 50 years. So much change has occurred. And when I look at this young generation coming forward and the accomplishments that they've already made, I feel so excited about the future because I know that we have tremendous leaders already and that they will be leading this country in a great way. So I just want to say thank you and welcome you to the NMQF family of 40 under 40. There's a tremendous network of those 40 under 40. I think almost 240 of them now around the country. And we encourage you to work together, to know about each other, and really provide the leadership that is necessary. It is my real great pleasure now to recognize someone who really doesn't need any recognition. I'm here to present an award along with our special guest, the Congressional Black Caucus Health Braintrust, to present our highest honor, which is the Bernard J. Tyson Lifetime Achievement Award. After Bernard Tyson passed untimely in 2019, the National Minority Quality Forum agreed to honor him by naming the Lifetime Achievement Award in his honor. He served as Kaiser Permanente's chairman and chief executive officer, and he was instrumental in working to eliminate health disparities and building sustainable, healthy communities by delivering affordable, accessible, and high-quality care to millions nationwide. He, along with Vice President Joe Biden, Merck's CEO Ken Frazier, and the Honorable John Lewis are all former recipients of this prestigious award. And today I'm so pleased to announce that we are honoring Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci has made so many contributions to American healthcare. We salute him for his strong leadership in providing voice to the voiceless, to working to eliminate health disparities, and protecting and educating people in major public health crises, including the AIDS epidemic, Zika, Ebola, and now COVID-19. As a trusted member of the White House Coronavirus Task Force, he is America's doctor, not only educating us about calming our fears and ensuring us if we follow the rules and the science, we will make it through this pandemic. Dr. Anthony Fauci, we honor and salute you.
Greetings to the leadership and members of the National Minority Equality Forum and other luminaries, including members of the Congressional Black Caucus. My name is Tony Fauci, and I am the director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health and a member of the White House Coronavirus Task Force. I am honored to receive the 2020 Bernard J. Tyson Lifetime Achievement Award. Mr. Tyson's decades-long commitment to improving access to affordable, high-quality health care for all Americans was truly inspiring. I am humbled to receive an award commemorating such a remarkable individual and to be included in the company of distinguished prior awardees, including Mr. Tyson and the legendary civil rights icon, Congressman John Lewis. I want to express my gratitude to the National Minority Equality Forum and to my esteemed colleague, Dr. Gary Puckrein, for this great honor. Mr. Tyson was a true visionary and thought leader. His many accomplishments in the healthcare field are inspiring, including his groundbreaking achievements while serving as the first African-American chairman and CEO of Kaiser Permanente. Throughout his career, Mr. Tyson worked tirelessly to reduce health disparities and promote equal access across the healthcare spectrum. His commitment to the importance of data and scientific evidence for providing quality, accessible health care, while always of vital importance, is particularly relevant today as we work to address the current COVID-19 pandemic. This unprecedented public health crisis highlights the importance of the ideals exemplified by Mr. Tyson. It also emphasizes the crucial role of community-based nonprofits and organizations such as the National Minority Equality Forum. You are doing critical work, shining a bright light on health disparities and bringing evidence-based interventions to bear in improving health care for all. My experience as a physician scientist addressing HIV/AIDS from the very early days of the pandemic, before we had effective treatments, to today, when we have the tools to end the HIV pandemic, yet so many still do not have access to these life-saving treatments, reminds me of the imperative of addressing health disparities. It is our scientific, political, and moral obligation to focus on the issues contributing to health disparities so that we can make meaningful progress in improving the lives of all people, especially those living with HIV, COVID-19, heart disease, diabetes, and the many other significant chronic and often life-threatening diseases and conditions that disproportionately affect people of color. While our personal experiences during this crisis will differ, it is important to remember that we are all in this together. I am heartened, despite the obstacles we face, by the unprecedented collaborations among public, private, and philanthropic scientific and public health organizations in addressing COVID-19. These collaborations have allowed us to move from concept to enrollment in large-scale efficacy trials of promising COVID-19 vaccine and treatment candidates in record time. As we evaluate these potentially life-saving tools, we must ensure that they are effective and accessible to all members of our diverse communities. We are working hard to ensure that participation in clinical trials reflects the diversity of the U.S. population. Partnerships between NIH and biomedical and community-oriented organizations, as well as the support of our brothers and sisters in communities of color throughout America, are crucial to these efforts. While I am cautiously optimistic that we will have a safe and effective COVID-19 vaccine by early 2021, we will continue to face many challenges in the days ahead. I remain encouraged by the ingenuity and dedication being exhibited by people across the country and around the world, and I'm confident that together we can overcome this crisis. We also must remember that many of the underlying conditions associated with more severe COVID-19 disease, such as diabetes, chronic kidney disease, and hypertension, are disproportionately experienced by people of color. In honor of Mr. Tyson and those who share his commitment to the elimination of health disparities, I sincerely hope that we can capitalize on the remarkable engagement and camaraderie we are building now to better address these long-standing health issues. Together we have the power to address the disparities that contribute to disproportionate burdens of disease in communities of color. I look forward to seeing firsthand the ongoing improvements in health care that the National Minority Quality Forum and others who are carrying on Mr. Tyson's legacy are making possible. I would again like to express my sincere appreciation for this extraordinary honor. I hope all of you stay safe, and I look forward to continuing to collaborate with you in improving the health of all of our diverse communities across the nation.
I know I'm in my office by myself, but there was no way I was about to let the great Dr. Anthony Fauci see me without a mask. Thank you so much, Dr. Fauci, and congratulations again on your award. It is most well deserved, particularly being the first award named after the late, great Mr. Bernard Tyson. Thank you so much, Dr. Fauci. So on behalf of all of us here at NMQF, I would like to present you with a very special gift. This, sir, you have earned is a black card. Keep it proudly. It gives you a lifetime pass to the cookout. Well deserved, and congratulations again, Dr. Fauci. I'm happy to deliver it to you in person when the world reopens. Now I'd like to introduce a great friend of all of us here at NMQF and a woman who has done the heavy lifting on eliminating health disparities throughout the United States Congress. She has represented Illinois and Chicago in Congress as the representative from the 2nd District since 2013, and she is the chairwoman of the Congressional Black Caucus's Health Braintrust. For our Lifetime Achievement Award presentation, which will go to, the Honorable John Lewis Lifetime Achievement Award presentation, which will go to Chicago's Mayor Lori Lightfoot, I'd like to now introduce the Honorable Congresswoman from Illinois' 2nd District, Ms. Robin Kelly.
Good afternoon, everyone. Thank you so much for taking the time out of your schedules to join us for this year's NMQF Annual Summit. As you all know, I have been working with the NMQF since I became the chair of the CBC Health Braintrust in 2016. While I'm sad that I cannot join you all dressed up in your finest, I am happy that this year we're able to reach a broader audience because of our completely virtual summit. In fact, I hope that in coming years, when things are back to normal, that we will be able to keep some virtual elements of this event. As we close this phenomenal event, I would be remiss if I did not give a shout out to Brandon Garrett, Kiko Purnell, Nicole Varner, my staff member, and our event staff for pulling this event together with so much gusto. We have experienced so much loss, but America has been made privy to the reality that so many minorities struggle with every day, from lack of healthcare access to police brutality and discrimination. COVID-19 has shown a light on the conditions that so many low-income and minority workers struggle with every day and overcome to raise their families and remain productive members of society. That is why I'm glad that we decided to host the summit this year, because this has given us a broader platform for the work that Dr. Puckrein and many of our 40 under 40 recipients do every day to fight against health disparities and find a way to make life better for so many of us. But we cannot forget the role that our elected officials play in this fight. My colleagues and I in the House have worked tirelessly to expand benefits, extend health care, and support Americans who have found themselves in the grips of this global pandemic, whether economically or with their health. However, I cannot deny it has been one heck of a fight. Just when we thought our fight could not get any more difficult, we lost the conscience of the Congress, really the conscience of our nation, Congressman John Lewis. This was a devastating blow in a year when we've been dealt a particularly tough hand. But to quote the giant himself, nothing can stop the power of a committed and determined people to make a difference in our society. Why? Because human beings are the most dynamic link to the divine on this planet. Those words move the soul and are why I'm honored to present the John Lewis Lifetime Achievement Award to my friend and colleague, Mayor Lightfoot. During the early days of COVID, it became apparent that Chicago's Black and Latino residents were being particularly hard hit. In fact, more than 70% of the city's first coronavirus deaths were Black people. Those numbers have declined, but Black residents continue to die at a rate 2 to 3 times higher than the city's white residents. Once this trend started to become apparent, Mayor Lightfoot rose to meet the challenge. She started working with community groups to create a Racial Equity Rapid Response Team, or RERT, which addresses needs in the Black and Latino community, ranging from adequate nutrition to jobs to healthcare. The response team has handed out free masks, hundreds of door hangers, and thousands of postcards about COVID-19 to raise awareness in our city's poorest neighborhoods and educate citizens on how to keep themselves safe. RERT has even pulled the local unions in to conduct outreach. Mayor Lightfoot has even been dubbed Auntie by some of the internet meme makers when she threatened to shut the city down if they didn't stay home rather than being out at the parks, reminding the ball players, your jump shot is always going to be weak. The work of a mayor is tireless and often thankless. I know the feeling. I'm in Congress. But I could not be prouder to be just one person in the lineup that Mayor Lightfoot can call on to protect our constituents. This is why I'm honored to present my friend with the John Lewis Lifetime Achievement Award.
Hello, everyone. I'm Mayor Lori Lightfoot of Chicago, and I'm humbled to be the recipient of the John Lewis Lifetime Achievement Award this year. I want to thank the National Minority Quality Forum for this incredible award, which was renamed to honor the life and legacy of an icon and civil rights champion, Representative John Lewis. Representative Lewis stopped at nothing to ensure that all people, no matter the color of their skin, had equal access to the resources they needed to lead happy, healthy, and fulfilled lives. As COVID-19 has made glaringly clear, those resources include quality health care. In Chicago, COVID-19 has taken a devastating toll on our Black and brown residents, who were particularly vulnerable due to health disparities and poverty they face at disproportionate rates. As mayor, it's my responsibility to ensure that all Chicagoans, especially during these uncertain times, feel safe and supported. So I've challenged myself to see COVID-19 as a once-in-a-lifetime opportunity it is to eliminate systemic inequalities in our city once and for all. This is a fight that NMQF is also familiar with. NMQF was founded in 1998 to establish National Minority Health Month and bring light to health disparities impacting communities of color. Since then, its members have worked tirelessly to spread information and awareness about these issues. Convening the first national annual summit on health disparities in 2003 to bring healthcare industry leaders together to discuss communities' concerns, as well as partnering with the Congressional Black Caucus in 2007 to host the summit, adding Spring Health Braintrust to the program, and introducing a heavier focus on public policy to the entire event. Turning information into action is key to breaking down systemic barriers. It's how our city has been able to mitigate the impact of COVID-19. We've made public health decisions based on the science of this disease, and we've already begun investing in initiatives like our contact tracing core, which will not only help slow the spread of COVID-19, but create hundreds of jobs for those in most underserved communities. Just as Representative Lewis taught us, we must keep fighting courageously, no matter the challenges we face, to secure equity and safety for all. And as Chicago's mayor, I promise to continue doing just that. Once again, I want to thank NMQF for this incredible award. It is truly humbling. The values it embodies will guide me as our city continues to respond to and recover from COVID-19. Thank you all very much, and please continue to be safe.
Thank you, Mayor Lightfoot, and I also want to thank our great partner, Congresswoman Kelly, for all of the work that she's been doing. Some of it you wouldn't even understand, the energy and power that she's had to force in order to get quality and equity healthcare for everyone. And it's been a tremendous partnership with her. I also want to thank Brandon Garrett, my chief of staff. Brandon is amazing. He's done tremendous work, including this summit for sure, but he's also helping with our alliances and has really been a force that has really helped to transform the National Minority Equality Forum. Also, to take a moment to thank the staff as well. We have a small, dedicated group, and we, because of COVID, we meet virtually 3 times a week, and we're always focused on how do we reduce patient risk, how do we build sustainable, healthy communities, and folks like Gretchen Wortman and Laura Lee and Naomi and Keiko Burnell and Leo Zhao. Many of you don't know Leo, but she's our statistician, crunches our numbers, does a fantastic job. Taylor Stera, who works on our data. Latasha Pasha Lee just came aboard, doing fantastic work. We are launching a clinical study with Centene that's around COVID. That's absolutely fascinating. And so we are really, at least me personally, I'm tremendously proud of our team, small but effective in doing great work. I also want to thank all the attendees. This has been, and panelists, this has been a fantastic summit. I miss seeing each one of you personally, talking to you out in the hallway between sessions and meeting after the summit. It's really been a heartbreak that because of this virus, we're not able to gather together as we normally do. And then Mayor Lightfoot reminded me of the early days of the summit back in 2003 as we came together to really talk about and work towards the elimination of health disparities. As we start to close and bring this session of the summit to an end, I have to say, and I know it was said repeatedly during the summit, but I would be remiss if I did not say this to you again. We have to vote. We have to vote. Democracy is about exercising the franchise. We cannot eliminate health disparities. We cannot reimagine our healthcare system unless we vote and need to get our family, our friends, our neighbors, the people 5 miles away, 10 miles away, 100 miles away. We got to get them to the poll because there's where change begins in our democracy. It is the weapon of choice in a democracy is the vote. And it is that power that will transform the American healthcare system and bring us to a place where healthcare is equitably distributed so that no one comes into the American healthcare system having their risk for a poor outcome elevated. And it all begins with that vote. I also want to thank our sponsors. You know, none of this gets done without our sponsors. And we really appreciate their commitment and their collaboration. What you should know is we collaborate very closely with our sponsors. They are interested in eliminating health disparities, and they appreciate that in order to do that, we have to reimagine our healthcare system. We have to do something about clinical trials to make sure that they're more diverse and representative of the American population. We have to address the issue of access to make sure that because of color or race or household income or language, that you don't get access to quality care. They also know that as we move deeper into the 21st century, we're on the edge of a medical revolution that will transform the way in which we do healthcare, from telehealth to wearing biometrics to editing at the genomic level for diseases like sickle cell, which we will really go in to the code book of life and bring relief to patients who have long suffered with that deadly disease. That's the work that our sponsors have been doing, and we are so proud to be able to partner with them. And I also want to call out finally the work that we've been doing with the federally qualified health systems. Remarkable organizations around the country that are serving the underserved and making sure that the least of us have access to healthcare. And it's been really a great pleasure and an honor to figure out ways that we can support the work that they do. So as you go home, the message that we want you to carry away is, number one, you got to vote. You got to get everybody voting. And then finally, when we come together again in January to start the work of reimagining our healthcare system, we have to build a healthcare system that is far different from the inequalities of the legacy system, in which it was okay for some people not to have quality healthcare and have their life shortened, end up with disabilities, and have a poor quality of life. That's the work at hand. We're excited for it. In these last few days, hopefully, we formed those collaborations in building the plan that we can take forward next year. So everyone be safe, wear your mask, wash your hands, social distance, vote, and let's get to work to transform this healthcare system. So thank you very much, and look forward, hopefully in April, to seeing each and every one of you. Thank you.